Hi, thank you all for coming. As you know, the government is now in shutdown. I do not like shutdowns. They are absolute indicators that the political process is breaking down. It creates a lot of unnecessary hardship. Now, why are we here is a fair question. We're here because the Affordable Care tax credits that help working people buy health insurance are about to expire. They are going to expire, and people on November 1 are going to be getting notices from the insurance companies about how much their premiums are going to increase. The supposed what the Republicans are putting forward right now is a continuing resolution that would expire on November 21st. People will be losing their health care by November 1st. So this is a matter of absolute urgent importance. And what are the tax credits? They go to folks, 45,000 Vermonters, 5 million Americans who buy their own health insurance on the exchange. And there are tax subsidies that help pay the premium. Keep in mind, the folks we're talking about are families, they're small businesses, they're people who are in the middle class, are struggling to be there in this time of really high expenses. And we can see premium increases that at minimum will double, and in some cases, they'll go up by $23,000. That is absolutely impossible for a family, $2,000 a month more to pay for. And I have been working hard to try to talk to my Republican colleagues about the mutual importance for them and for us, both parties, to resolve this, because people in Vermont are going to be adversely affected. It's going to hammer them. And you're going to be hearing from some of our great leaders in Vermont who will tell you specifically how this is going to hurt them. But this is something that's going to hurt folks in Iowa. It's going to hurt folks in Texas. This is not about who you voted for president. This is about health care. So if we see these doubling of premiums, and in some cases, doubling could be in the range of $20,000, it's going to mean that family, that business is going to have to make a decision about whether they can continue on getting their own health care. And for a lot of folks, it's impossible financially to be able to take that hit. Now, then what happens? If you go without insurance, then doesn't mean you don't get sick. You show up at the hospital, and then the hospital provides care. They're not compensated. And then there's financial pressure on the hospital. And what we're going to see is that this puts wicked pressure on our community hospitals that are so important in our communities all around Vermont. And we risk losing community hospitals. And that's true all around the country. This crisis that we have right now has to be fixed. And my outreach to Republicans is that this is good for the people you represent as well as the people that I represent here in the state of Vermont. This is something it's absolutely within the power of the United States Senate, the United States Congress to fix. These premium increases are beyond the control of any individual, any family, or any business. They just have to pay the bill that comes their way. And this escalation in the cost of health care is a real crisis for our families. There's nothing more important to the well-being of a family and their family security and for a business than to make certain that if a loved one gets sick, they have confidence they can get the care that they need. So today we have several wonderful folks to help us understand the implications of this. And we're going to start with Alyssa Black, who is the chair of the House Health and Welfare Committee, but also has her own business and is going to be directly affected by this. Alyssa, thank you.
Thank you. So I am Representative Alyssa Black. I am, as Senator Welch said, I chair the House Healthcare Committee. And yet Senator Welch did not invite me here today for that. I am also self-employed. When I left the legislature, I was unable to maintain full-time employment with my employer of the past 26 years, who had always provided me with health insurance coverage. And because of the advanced premium tax credits, I was able to move to a small business, which I am now the co-owner of. And the only reason I was able to do that was because of the advanced premium tax credits that I would receive to buy my insurance through the exchange. It is the only way that I can buy health insurance. I will tell you, my premium is approximately $460 per month currently, but I make just over the limit, middle class. I make just over the limit where the cliff is, in which the advanced premium tax credits allowed for people like me to be able to afford insurance on the exchange. As of January 1st, my premium will go up, a single individual person, it will go up to over $1,200.
Wow.
And I
Per
cannot
month?
afford that.
That's per month, right?
That's per month. That is more than my mortgage and taxes. And so next year, I will be making the choice for the first time in my life. I will be making the choice to go without health insurance. And it is frightening to me. And not only that, my role in the legislature and as chair of healthcare, I understand the ramifications of not only to me by not having health insurance, but to the system as a whole. When relatively healthy people like me leave the market, what it does is it leaves the individuals who need to maintain their health insurance because they are less healthy, and that raises the cost for all of us. That's how health insurance works. Healthy people pay in, sicker individuals pay in, and we all benefit when it comes our time to utilize the care that inevitably we will all need to do. And so this doesn't just affect me. It raises the premiums for other individuals who have to buy health insurance. It raises the premiums for small businesses and large group employers. It raises the premiums for everyone every single time someone goes without health insurance. We have worked very hard in this state to try to insure everyone, and we have very high insurance rates through years and years of work in making health insurance accessible to everyone because it keeps costs lower for all of us. Just because you don't have health insurance doesn't mean you still don't need health care. And that health care then becomes uncompensated care, which costs the whole system even more. So, I applaud the efforts of Senator Welch to try to extend these premium tax credits. Again, this is something that is beneficial for every single Vermonter, whether or not you are the one receiving it. You are benefiting from it. We're all benefiting from it. Our whole system of healthcare, our hospitals rely on it. If those hospitals are not there and those healthcare providers are not there, it doesn't matter what you have for insurance. You no longer have access to care. So thank you for your efforts, and thank you for inviting me.
Yeah, no, thank you.
Thank you.
Thank you. By the way, Michael Fisher is here, and there he is. We worked in the legislature together, and he's been a healthcare advocate and leader for years.
Just a few years ago.
Yeah, but I appreciate that. And Earl, there he is, Mr. Handy. It all started here. I want to thank you for letting us be in front of your. We hope we're not blocking the way for some hungry customers, but thank you very much. We've been at this a while. And now we're going to hear from Alex LeClair, who's going to talk about his personal experience of an employee of a small physical therapy practice. Thank you. Yes.
So we have about 10 employees who are on the exchange. Everyone's premiums, single person, it's going to go up $10,000. A family of 4 is going to go up $30,000 in premiums and out-of-pocket expenses. They do not have that money, and we do not have that money to give them to cover those costs. There's a built-in self-check mechanism into the ACA subsidies. It's your tax return. If you make more money, you have to pay that back at the end of the year. It's built into the system. Our system is really on the verge of collapse if we don't do something about this across the country. Farmers, small business people, automotive shops, plumbers, electricians, HVAC companies, all of them get their insurance through the exchange. It is very important that we get those subsidies extended, and that is your job.
Well, you make a point. It's our job. I mean, this is Democrats and Republicans who have the responsibility to be doing things that deal with a broken healthcare system and not inflicting the pain on you and your employees. So you are absolutely right about that.
The other thing I'll say too is the patients who come in, they are getting the subsidies. They still have to pay for the deductible.
Right.
They still have to pay for their copays. It's not a free giveaway. They just can't afford the premiums plus the deductibles. That's what's at issue here.
That's exactly right.
Thank you.
Thank you very much. And now Lisa Mason, who has her own incredible business, Fiddlehead Cuisine, and all of us want to become customers. But it sounds really good. So Lisa, come on up.
Hi, my name is Lisa Mason, and I own and operate Fiddlehead's Cuisine, a prepared meal service in Moortown. I serve fresh, healthy dinners to my customers in central Vermont. So I started this business at the age of 25, and I was freshly back to Vermont, where I was born and raised here, after completing a natural chef program in California. I created a prepared meal service specifically, which offers my members ongoing weekly meals, because I wanted to meet the need for fresh, healthy food on a regular basis. That's both convenient and affordable, and even when time is tight and funds are limited, people can do it every week. I want it to be something a family can afford to do for years on end to take care of themselves. It's a service that promotes health, creates community, and supports balance in this hyper busy world. As you might guess, being a solo entrepreneur has many benefits and some trade-offs. In my experience, it's been an incredible way to do what I love on a daily basis and feed my community over 15 years. I've been in business. However, the financial balance can be pretty precarious. When considering whether to start or stay in a small business, you have to contend with the reality that your position comes with no benefit package. You will not have paid time off for vacation, for sick time, let alone for family leave, as I discovered after having my children twice. You will not receive retirement contribution matches or health insurance benefits. This is no insignificant hurdle. One of the only ways I'm able to make a small business work while still meeting the financial needs of my family is due to the accessibility to quality healthcare through the state marketplace with premium offsets by significant tax credits. Without this, it would be very challenging to make the numbers work. And I do believe that myself, as well as thousands of other small business owners across the state, would need to reevaluate whether they can realistically afford to run a small business. Healthcare costs are a driving force in every budget, but the reality is it's just one of many. The costs of goods have been going up for years, as has the cost of living and housing. Even with tax credits, healthcare is increasingly expensive. Many can barely afford it as it is now. As was said already, I have health insurance through the state. I get great tax credits for the premium. I still pay out of pocket for every time I go to the doctor because my deductible's $17,000. I've never met it. Only so many factors can rise at the same time before the balance turns towards unsustainable. I know that I'm not going anywhere and I will continue to be here feeding my community, but without access to affordable healthcare, I would be forced to make the very difficult decision of whether to forego health insurance, which is a pretty irresponsible gamble as the mother of 2 children, or forfeit the ability to invest in the future of my family in the form of retirement savings and college funds. Either option would be a huge blow to financial security. As someone who believes deeply in the need to care for each other, I believe maintaining the access to healthcare is vital to keeping Vermonters healthy and optimized for success. It's not good enough just to have guaranteed access. It needs to be affordable access to truly be accessible. I really appreciate your work, and thank you.
No, thank you. I mean, it's so moving to me. And what I find so sad is that we could be in the reddest of red districts, and we would have folks who were doing physical therapy, folks who were providing meal service, folks who were being bookkeepers, and they would be juggling the incredible challenge of raising a family, of serving their customers, paying the bills with rising costs, and then suddenly we're pulling the rug out from underneath them on what is most important for their sense of confidence and stability, and that's healthcare. And like Lisa said, you're the mother of 2 kids. It's an irresponsible decision to not have healthcare, but if you get whacked with $1,000 premium increase, that may be the only option you have. And this is all avoidable. And it's all avoidable if Republicans and Democrats sit down to meet the needs of the people we represent, where they share this need for accessible and affordable health care. And it's really upsetting to me that President Trump has directed the Republicans to not even talk to us. When you have disputes, as we do in Congress, about a policy difference, the only way you resolve them is by talking about them and finding that common ground. And there's so much common ground here because the needs that Americans have to have affordable health care, we have a broken system. And that does not diminish the need folks have for health care, but we've got to sustain what we have and not make a bad situation worse. So I'll return to Washington, and I'm going to continue my efforts to reach out to my Republican colleagues and say, hey, let's do something that's good for the people you represent and the people I represent here in Vermont. Open it up for any questions, but thank you. That was so moving. I mean, it's just unbelievable. I can't believe with all the things you guys got to contend with, now suddenly you're dealing with this hammer blow. It's really something. Thank you. Yeah, you can address questions to any of us.
Senator, quick question for you.
Yeah.
You're going to be voting later today. I think there's several Democrats. I think Independent Senator King, Maine, have already sort of
Right.
and said, hey, we want to keep the government open. How confident are you that the Democratic opposition here will be able to hold as the shutdown continues?
Well, number one, I do not like a shutdown. None of us do. And what's different about this is that the president explicitly told my Republican colleagues to not talk to Democrats. That's never happened. In the past, the president has been the convener in chief, getting the parties together to work out the policy difference and solve the problem. So we're in this terrible situation where we can just give up on healthcare, and you can see the impact it's going to have on real people doing real jobs with real families in our community, or we have the shutdown. So I get it. My colleagues like Senator King speak for me when they express their horror at a shutdown and the collateral consequences that it does to people in the economy. But we've got 45,000 Vermonters who are going to be they're going to be out of luck if we don't get this health care continued. And we've got 5 million Americans who are going to be out of luck. And it's so solvable if we just sit down, because it is not a difference in need. It's not like this is going to benefit one part of the country or blue states. This is going to be essential for every bookkeeping small business, every small food operation, and in every small physical therapy operation across the country.
Speaker Johnson said that they can negotiate on the health care subsidies, just do that later this fall. Do you see that as being
I don't.
cards at all?
No, it's totally bogus. I mean, there's a lot in the House, including Speaker Johnson, who are opposed to these. But the real issue here is that November 1 is a drop-dead date. That's when these folks right here are going to get a letter in the mail saying their premium goes up $1,000 or $1,500 or $10,000 over the year. So when we talk in Congress about negotiating it tomorrow or later, these folks are going to have to deal with the real world of paying a higher bill today. So November 1 is a real deadline, and the Congress is utterly irresponsible if we don't act. And we've got plenty of time to act before November 1 and extend the Affordable Care Act tax support for folks to get their health care.
Senator, we usually hear from the higher-ups in Congress, like, House Speaker Johnson, etc. When you're talking to your GOP colleagues in the rank and file, do they understand the significance of this situation? And if they do, why won't they vote to change things?
Number one, they do understand, because they have as much respect for folks that are here as I do, okay? That is hard to run a small business. That is really a really hard thing to do. And they get that. But the reality is, unless they get the okay from Trump, they're more fearful of Trump than they are of the reaction of their own constituents. And that's unfortunate, but it really does reflect the power and the grip that the president has on the Republican Party and their willingness to come to the table here.
Do you have any idea why President Trump is so adamant about potentially impacting his own supporters through this?
Well, what's happened in the first Trump, just a little background, that's a good question. If you remember, in the first Trump administration, there was an effort to repeal the Affordable Care Act. We voted in the House about 60 times. And it was towards the very end that it got through the House, but it was famously saved by Senator John McCain with his thumbs down vote. But it was one vote. So there was a lot of talk and a lot of action. In the second Trump administration, there's much less talk, but much more effective action in dismantling it. We saw in the One Big Beautiful Bill, there's $1 trillion in cut to Medicaid. And that's going to be devastating over time to Vermonters. 2 out of 3 people who are in a nursing home, it's paid for by Medicaid. Our disabled kids, their health care is paid for by Medicaid. So that is a big blow. The number 2 attack is on the tax premiums that help small businesses and families, folks who are here. And that's about 5 million Americans. 45,000 Vermonters. So if they're successful in getting rid of the premium support, they'll basically have unraveled Obamacare.
OMB Director Russ Vogt has said that this time around there could be some permanent firings during the shutdown. Any idea if that's happened yet, or if not, which federal jobs here in Vermont may be at risk?
First of all, I want to make it very clear. The administration, the president and Russell Vogt have no additional legal authority to fire people in a shutdown. People can be furloughed. They can't be fired. Now, having said that, we're seeing that President Trump does not restrain himself just because the law constrains him. He'll act. So if he acts, it's without legal authority, but it's typical of what the president does. Well, thank you all. Go ahead.
Here you are in the Burlington area today, spreading your message. Are there other areas of the state you're trying to? What other ways are you trying to contact the public to get your message out around Vermont or New England, or what are you doing?
Well, Bernie led a live stream. I know my colleague Becca had a press conference recently, and we're doing everything we can on social media. We're doing everything we can, meeting with healthcare executives. But the most compelling speakers about this to get the word out are the folks who are right here. I mean, we pride ourselves on having a big small business base here in the state of Vermont. And what you heard, I mean, running a meal operation with 2 kids and all of the cost and all of the logistics, a physical therapy business where you're helping folks get back on their feet, and you don't have any control over this big bill that comes in. It's not a big, beautiful bill. It's a big monster bill. And it just amazes me because, the job that we have in Washington, whatever party you're in, is to have policies that make it easier for folks like this who have these small businesses, easier for them to do their work, not harder. So this is totally inexcusable that the Congress doesn't get its act together and extend these premiums. People in red and blue states need this. And, you know, it's a disgrace that the healthcare costs are rising as much as they are, because folks who need healthcare have no control over the cost. That's where the legislatures, the U.S. Congress, and the president have to work together to make healthcare affordable. Thank you.